Okay, here I am. Hello. Hello, everyone. My. What have we here? look at stuff. Interesting. Okay. In any case, hello everybody. How is everyone's dumpster? I know not that one. I'm talking about the one that is your life. Is it on fire? Is it clean? Is it dirty? Is it full of maggots? How is that dumpster? We often call a life. Hopefully it's well. Hopefully it's good. Let's see here. There's a few of you here already. About 5, 6 between the two, Twitch and YouTube. Yeah, I know I'm late. Really late, actually. Apologies for that one. Had the stuff to take care of. Had to take care of a couple of things, other issues, IRL and server related stuff. But hopefully it's all good. Okay. How dare I? Yes, how dare I? Let's see here. All right. All right, looks like we're good. All right, cool, cool. Everything's running smooth. Okie doke. All right, so today, what I wanted to talk a little bit about is something I had a discussion much earlier today with a friend. We were talking about, you know, schizoids and therapy, and what that would require, what kind of foundation that would require, what kind of ideas would that require, how can it be done, how can it be possible, what are the parameters for such a thing. You know, it's a little bit of armchair fun, basically the situation on that one. And yeah, I was thinking a little bit more. I was reading back on some things and thinking back and reading some stuff people have said on the server and other places, or directly contacting me about their experiences with psychologists, therapists, things of that nature. And, you know, obviously no schizoid adapted person is going to be, there's no like all-encompassing or uniform type of method that's going to work on, you know, even the vast majority, except for certain aspects or certain things that I think would actually be universally useful, at least among schizoids. Certain parameters and ideas that I think could prove of use, were they to be considered more thoughtfully or implemented in a therapy situation, when it comes to schizoids. And I kind of want to go over that a little bit. Even though I know there's plenty of zoids out there that are very much, they consider things like therapy and psychology and everything of that nature to be like anathema, or they've had incredibly bad experiences with it, so that they might have a complete like disinterest or disregard, or have already had sort of a dismissal in their minds of such things, or their capability to actually function as being helpful. And I really do think a lot of it has more to do with the base, the foundation for a lot of what therapy and psychology generally tends to be, and what's more conventionally functional, how unproductive it would be to implement such things on a schizoid, or attempt such things, or have certain assumptions that are kind of more or less universally understood about like human behavior, and how they process traumas, and a lot of stuff like that. A lot of stuff like that is these kind of more conventional understandings about what motivates people is the kind of stuff that might not be entirely conducive to the average schizoid that is attempting to get help. And And I want to talk a little bit more about what some of those things are. Perhaps if anybody else has opinions or thoughts on it, would be extra interesting. But yeah, and the reason I recognize that there has to be significant differences on how any of this is approached is even within the literature itself, especially stuff that's a little more up to date. If we're talking about not just theory, not just like, we're not just talking about like all these theories as to why a schizoid is a schizoid and what happened and what are exactly the types of core traumas and all that kind of stuff. And that's always back and forth, and that whole thing's a mess. And I don't have to explain again for the umpteenth time why I think that. But it's rare, and only in probably slightly newer literature do you see anything about like the practical or practice of trying to help somebody that is considered to have schizoid personality disorder. What actual approaches, real world, practical approaches you can actually implement in a therapeutic situation that would actually allow for progress to be made. That's not like a common, that's not an often discussed thing, because the subject itself is very niche. And like I said, even within like older literature that covers it, it's mostly going to be about what is it exactly and how does it work. And even older, not even super old, like I'm talking like 80s, 90s, 2000s, and early 2000s, like case studies, as few as they are, regarding schizoids. It always feels as if like the schizoid tends to be like this kind of unsolvable enigma. And even like some of the more positive sounding stories still make it sound like the psychologist wasn't even sure exactly what it was that worked when something did kind of work or seemingly worked. And many a times it ends with like, well, the person basically stopped seeing me one day, and then it's like, okay, so we don't know, we don't have a lot of information on like long-term, very long-term therapeutic possibilities or anything like that. But usually, right, when there is a guesstimation that's made about like about how long it would take to even make any progress, I personally think it's absurd, but they say something along the lines of like, like a decade or some shit like that. And it's like, wow, that's not going to encourage anybody to try. Ain't nobody got 10 years. And I don't think it with the right conditions and the right things, I don't think it's a fucking 10-year project. Especially when you're actually, well, I'll explain what I mean. So, some of my beliefs regarding this are that, and this kind of falls in line with some of what McWilliams has said, definitely what Greenberg has said on the matter in regards to the practice of treating a schizoid, is, making use of the environment. So in other words, having your actual like office or chair positioning, or the offers or suggestions you make, the way you couch them, the way you word them, with the utmost sensitivity to the person that's schizoid's autonomy and their ability to essentially opt out of any situation at any given point when they feel it's apt, right? Including even being there. So that's actually like one of the more conducive environmental things a therapist can do when they have this kind of client. Right? Don't and it's always really these subtle things, right? Because for example, have more than one seat available as to where the person can sit, so that they're not required to sit in a specific chair, in a specific place, or even sit at all, right? Just have options be made and allow that person to make their individual choice as to where they decide they want to sit, or how, if they want to sit whatsoever. That's one example, right, of like a atmospheric sort of condition that would be more suitable to help in the Zoid, and have a conversation. Other stuff would be basically have options that don't let them have to put their back to the door, or they could see the door from where they're sitting wherever they want. Like basically they walk into the room and they have multiple angles, multiple places in which they could find that spot that they're okay with, they're vibing with, and then they can sit down or do whatever and talk, right? And a lot of this sort of almost symbolic nature of like feeling like there's an out and there's not some obligation to be there, some forced sense of being there, are some of the things that even Dr. Greenberg has mentioned about how to kind of produce a more conducive environment for that sort of stuff. Um, a couple of things too is the words you use, how you speak to somebody that has schizoid PD about what you're asking them, things like that, right? I would say one of the most often, um, the biggest problems is basically statements that remove the person's agency, statements that make too many assumptions about the client's motivation and willingness to try or not try certain things, assumptions about what they have done, haven't done, thought about, not thought about, right? A lot of that sort of stuff is oftentimes detrimental, in my opinion, to creating a more conducive therapeutic environment for somebody that's a schizoid. Um, uh, Asking questions directly, uh, bluntness, sincerity, just directness, and when the the therapist doesn't know something, just ask. Just ask. And that sort of directness can often be very conducive because it's transparent. It's you make it very clear and obvious what it is you're doing. If the person there for therapy that's schizoid is like, maybe wary of therapists, maybe uncomfortable about the entire notion, or is very cynical, pessimistic even about that sort of stuff. The therapist is often they can gain some. It sounds weird to say gain some therapeutic ground, but if they just straight up say like, okay, this is how I'm approaching this. This is the method, the style, the technique that I'm currently implementing or going to be using while we talk. Um, it basically just showing them their cards when it comes to their professional expertise, right? Actually being open and honest about what they're doing exactly, or what framework they might be using or what their background is, or frameworks they're used to using, and what aspects of those frameworks does the schizoid patient not find suitable to them or conducive, or and ask them, why do you think that is, and allow them to explain themselves as to why they don't find it to be conducive. And that's not to say the therapist or the psychologist shouldn't challenge any of this, absolutely, right? But even the manner in which it is challenged should be done on not an authoritative tone, but more of a we're just two people talking, having a conversation. The subject just happens to be you, and it doesn't have to be directly you, but we have a basically mutual understanding that that's kind of what's happening, regardless of what the topic is. That's what this environment is for. It's to allow us for some kind of therapeutic session to occur between myself and yourself, right? Like, just that kind of language, that kind of openness, that kind of transparency, um, is my armchair opinion to some of the basis and some of the basic foundations as to what would be most beneficial to a professional dealing with somebody that has schizoid PD. Right? Those are some of the best ways to not necessarily create trust, because trust is not oftentimes an easy thing to get from somebody that's schizoid PD, but at least respect and for each other's autonomy, and an honesty about the reasons the people are there, and to allow the schizoid to be honest about why they're there and how they feel about that situation, or not feel sometimes, but just be able to express that openly without any kind of concern or assumptions being made about their words. So I think that is like a nice little precursor, a nice little I mean, there's a lot more. There's many elements. If you're interested, you can ask me questions in chat. You can jump on the VC and ask me. And like, again, I'm not a medical professional. These are just my bullshit armchair ideas based on the literature I have read, the experience as I have heard from schizoids, from psychs about their experiences with each other. But obviously, I get way more, and I get to read and hear a lot more about schizoids' experiences with the psychologist or therapist or counselor or coach or what have you. Because it's not like there's too many therapists, I would say, or psychologists that have actually dealt with somebody that has schizoid PD. In fact, I would assume that those that have, the vast majority probably didn't even know or never had an opportunity to discover, or were just absolutely unaware of its existence. So they might have, done things like they conventionally would with other types of patients with anxiety and depression and things like that. And those very actions might have been what caused that person to only go for 2 or 3 sessions and then just kind of bail, or maybe even less, right? And then oftentimes zoids will be kind of a little bit, they'll be, what's the word? They'll do, I mean, it gets into a little bit of that objects relations fun stuff, but like they will kind of bad object entire sectors of things and approaches in regards to what will be useful or helpful to them and their troubles. Like that's definitely, they'll have like 1, maybe 2 bad experiences, and then it's like that doesn't work. This thing is no longer useful, valid, practical. I will put it in the not useful to somehow help me with this empty void that I feel inside me box over here. And then it'll kind of just stay there for a very, very long time. And oftentimes maybe permanently. I don't feel like schizoids tend to do that with people, specifically people, like individual people. They might do it as like with people, as in like humans, right? Or their general understanding of like what humanity is sometimes. But they'll do it with certain sectors of society, sectors of institutions and accumulated knowledge that, and stuff like that. Right? I see that a lot. It's like they might not go like, oh, all psychiatrists are, necessarily, or psychologists are all bad people. They will often state like, oh, the field is, not good because of these following reasons. The whole thing is tainted, unusable, so on and so forth. And it's really interesting considering the amount of nuance and context the schizoid will implement usually when it comes to things that are not directly or in association with themselves. That part's really interesting. And I see that very, very much, very consistently. And I'm not saying that's for everybody out there listening, because I'm just talking about what I have come across and what I've experienced and what I've seen and what I've lived through as well, personally. So it's all anecdotal bullshit, I know, but hey, that's all I really have at the moment, right? And that's all anybody really has at the moment when it comes to this subject. Well, there's literature, but there's not a lot of real-world application-related literature, unfortunately. I doubt there's a course out there. I honestly, I would be surprised if there's a course out there about, like, just cluster A. Like, specifically. I would be surprised. And even within that course, I would be more surprised if the course didn't compromise more of paranoid and schizotypal, and, like, schizoid is, like, briefly covered or something of that nature, right? That would be my guess, if at all, if there is somewhere in some school that wants to have a specific cluster A type, for their PhD candidates or something. But yeah. So anyway, as I was stating, that environmental condition thing is just one step, right, toward, and then some of the language that's being used, the way it's approached, but it gets a lot deeper than that. It gets a lot crazier. It doesn't seem crazy to me. I think it's actually pretty intuitive what it would require. In fact, here, let me switch this up here. Oh, is this even up? Oh, we got shadow here. Hold on. Let me lower this music a little bit more here. It's too loud for me. It might be fine for you guys, but it's too loud for me. Okay. As I was saying, some of the things that I think would be incredibly beneficial, I've actually attempted, and like I said, I'm not a therapist. I can't say anything about like, oh, this works or this doesn't work. I can't make declarative statements about any of this. This is just, again, my just non-medical opinion on this very matter. And what I have noticed, and I've essentially implemented when people have asked me for advice, or when I was doing the coaching stuff as well with Joanna, when the group thing was still going and everything, I had kind of dabbled in some experimentation regarding my own views on what might kind of function and not function when it comes to some of these ideas and approaches, and just out of my personal curiosity, right? And I have seen some of it kind of work, at least in that particular instance and situation, which is isolated, has nothing to do with the whole. I would say, but nonetheless, it's just a anecdotal type stuff, where the type of language that I would find comfortable, right? Because basically the idea is I've tried using. Hold on one second. My little one just ran in here like
I
a
need to
demon.
run. I need to run. I already got yours.
Okay. Bye bye. All right. So she just came in like a little bat out of hell, gave me a kiss goodnight, and left. That's unusual. Usually she runs around in circles for a while, or something of that nature. In any case, oh, hello. Hey there. Wait, what? Winter. I thought it was Withers for a second. I was like, what? I'm like, oh, okay, that's a new name. Hello, Winter. If you're an annexite, let me see.
They're a schizoid.
Oh, okay, then yeah, they're cool. I don't have to like unmute them and stuff. If for some reason you can't
Oh,
talk,
maybe.
I don't know. If for some reason it's not letting you talk or anything, just drop it in chat. And oh well, maybe they didn't know what they jumped into. That's often what happens, even if I label it live stream.
They unmute different. I don't know what they're doing.
What?
I'm not going to talk about. They're doing something. I don't know.
Oh, okay. Well,
Ignore me.
very well. Well, like I said, I'll help them out to talk if that's what they wanted to do. But yeah, and some of those, I guess, like methods are methods that I would find conducive, or I did find conducive when it came to my own psychologist, right? Like I'm like, and I would have these discussions with my psychologist. I would be like, hey, that thing you did, the way you talked about it and approached it that time, that was functional, that worked for some reason. That one got my mind going in the right way, and it didn't like feed into any presuppositions I had about this process, and this is earlier in my therapeutic process with my own psych, and so then we would have discussions with her about why it worked and so on, and then I would just obviously be thinking about that all day, and then I would think about the people on the server, and then I would think about like some of the comments left, and some of the other things, and then I would be like, okay, so at least in my case, because it's intuitive to me, when somebody's like, oh, Angst, I need some advice, or I'd like you to answer some questions regarding something I'm going through, or what have you. I just kind of think back on those things. I think back on the things that seemed to be more conducive to me being able to express stuff or word things or construct better understandings of some of the internal workings or machinations or whatever. And then I would just kind of reflect that back. And sometimes I would get some interesting results. I would get, you know, as cringe as it is, like, I would get people, you know, mentioning, like, oh, you know, some of the stuff you have me thinking about right now, like, is stuff that I haven't been able to, you know, get out of a conventional form of counseling or therapy. Like, you made me think about things that I either didn't think about or thought were not applicable to me, and things like that. Because you
Yeah,
came at
I've
it
heard
from
it said that the biggest heavy lifting when it comes to therapy is done outside of the therapy office.
Mm-hmm.
So in the weeks building up to the next appointment, I think for schizoids especially, because it's really hard, if not damn near impossible, for them to trust other people. It's vital that they have something to go in with. Like, you have some sort of reference to base ideas off of. You have things to divulge yourself without just necessarily going in blind and leaving it up to the therapist to guide you through something.
Yeah, I agree. Most of when it comes to somebody that's schizoid, most of the aha moments and the actual the most therapeutic aspects are not going to be happening in the office. Yeah, they're generally not going to occur there. There might be instances in which it might happen, but most of the focus is going to be on how many ideas, how many things can we jar open, discuss, or contemplate during these sessions that can ultimately benefit them when they're, you know, going
How
through
much
it
homework can you
internally.
give me for the
Like,
time we
yeah,
don't see
thinking
each other?
homework, not actual homework necessarily, like physical activities. That might not always be the best, depends. But like, you know, like paper activities or like specific questions, but more like new concepts, ideas to think about that you help me kind of um,
Yeah,
digest.
that's a better way.
Yeah, and so and that could lead to stuff like what I was saying. Like, I've had a conversation with 2 hours with somebody or something, and you know, um, and then, you know, maybe a week later they'll say, "Oh, remember that conversation we had 2 weeks ago or a week ago? It helped me do this or helped me do that, and I think you know, blah blah blah." Right? Even if at the moment when I was talking to them, it didn't necessarily seem like, you know, I did anything particularly special at that given moment, but maybe I would have, maybe I kind of like, I don't know, like chiseled something, and then they did the rest of the work, or pointed at like, hey, there's a thing here, and then they're like, maybe there is, and then they just kind of did their own thing, and I think definitely that's one aspect that needs to be very very much honed in on by said professional is just they have to basically run under the assumption that they're just a tool for the schizoid to
A medium, per
a
se?
medium,
Not
yeah, not a tool,
necessarily a
yeah,
tool?
yeah, a catalyst or a medium to allow them what they need to make that internal progress. Since most of their, since you know, they're spending so much of their time introspecting, questioning their own motivations, questioning their own, well, their own existence, questioning their own ideas, questioning their place in the world, questioning. Like, that's just something that's constantly occurring, and I think
That
a
in and
lot,
of itself, though,
yeah,
is really important.
well,
You're
yeah,
letting the schizoid express themselves. So the very act of them studying in that office, and you allowing yourself, therapist, to be used as a medium, is the trauma, like part of the trauma work in and of itself.
no, yeah, I mean, because if you show up, like, one of the best things, in my opinion, that a therapist, or, well, let's just say a psych, because a conventional, I want to go into that, but basically, one of the best things a psych can do for that kind of client is ask them, okay, what have you discovered? What have you figured out? What do you think's happening? according to your own theory of self? What have you surmised? Because they've been fucking around with this for like a good chunk of their life, not all of it, depending on their age, and that's what the psych should be working with, and with it is all
This
the
is a really
available
novel
information.
idea, though, because when you look at literally any other personality disorder or maladaptive like schema behavior and whatnot, that is not how you work with
No,
a patient.
no.
That is the opposite of how you.
No, yeah, that could actually actively cause problems.
Like this is this is
that's why it's kind of radical. That's why it's very radical because it wouldn't normally work.
Normally by like any other definition.
Yeah.
Like any other. This would be the only exception I'm aware of.
Yeah. I mean, it kind of in many ways because one of the major differences between this personality disorder and any other is the amount of self-awareness it usually involves. Self-awareness to the point of like that it's oftentimes crippling. Self-awareness of like from almost like looking at themselves from like a third party position. It's often it's only there's very few people. But a lot of schizoids, they can basically look at their own mind through a clinical lens, right? Like they're almost studying their own thoughts more than actually feeling or experiencing them, right? And so you can have that conversation with a lot of schizoids, at least the ones that are willing to have that conversation or can find enough comfort in the person they're telling to be able to discuss it in some kind of open way, even if they can't directly discuss how I feel, what I need. They might be able to discuss what this person that you currently are supposed to be needs and wants or experiences, like in almost like a separated way. Like that's another thing that would be normally counterintuitive to a conventional sort of therapeutic setting or such, is allowing the client to separate themselves from themselves and then discuss that thing with the psychologist without constantly or consistently referring back to it as it being them. That's obviously something that may come with time, but that is not something that is going to be necessarily useful, depending on like the gravity of the situation, how long they've been dealing with it, and the levels of trauma in conjunction with the trauma that's already kind of there, they have been exposed to. So yeah, I mean, it's really interesting. Yeah, there's a lot. That's kind of what I also wanted to bring up. It's just like there's aspects of the way you approach therapy when it comes to the schizoid that I think that normally would be, like I said, counterintuitive to the profession itself.
Like not just normal, but like very key aspect here, radically different from any other therapy.
Yeah. And I don't think, and I know some people differ with me on this. I don't think it's because the schizoid's so fucking uber smart or uber introspective and uber this or that. I think that their trauma-based adaptations basically led them to being that introspective and self-aware about a variety of things and mechanisms and make them what and who they are internally.
It's one of those things where if you're not so emotionally connected to yourself, you kind of just end up in that position, not because you're like vastly superior, but just
I'm so introspective. It's like, no, it's more like I had to be introspective to get through life.
If you're not emotionally connected to anything, then you
have
like
to study everything.
Kind of are like you are like the observer. Like,
that's a whole outside looking in.
You can't just be exempt from both inspection and connection. It's at least one or the other.
Yeah. I mean, you could, but then at that point,
I don't know.
That's a whole different situation.
I think that borders on
I mean,
more
they might be a little more
scientific, like
catatonic at that point. But...
I think that's like incredibly more on like the true dissociative disorders, not just casual disorders.
Yeah, well, yeah. No, yeah. But what was it? Yeah, the shit. I had a thing, and I lost it. It was about what you just said too. The therapy approaches. Oh yeah. What I was gonna say is the one thing that some people differ with me on opinion wise is about the stuff I constantly bring up about me believing
Neurodivergency.
Yeah, the neurodivergency aspect, right? And that's kind of why I would assume is why so many things that would be counterintuitive or usually not beneficial in a therapeutic situation that would be beneficial for a schizoid type patient or client is because that's the element that's not being considered. It might be radically different because the people you're dealing with are cognitively different in a significant way.
Why do you think it's not being considered?
Because it's not even being properly considered, even within autism. Like it's not being like well enough implemented when it comes to like I have autistic friends and I know autistic people, and when I ask them like, hey, what's your experience with like therapy or psychologists about your kids, they'll have anxiety and depression and all this sort of other stuff, and they'll just be like, oh well, they'll either say stuff like, oh, they just kind of treat it as one of my symptoms of autism, which is like kind of bananas in my opinion, or they'll try to help me in ways that would help a neurotypical person, and or they'll try to like shape what works into like what they think may work for me, and oftentimes that doesn't seem to be the case, and so like it just it doesn't seem to be a common experience that an autistic person with troubles or mental health issues is going to their psychologist or therapist and feeling like, wow, this person understands my cognitive situation in regards to the feelings I'm going through. They're more just like, oh, how do we manage those negative feelings, not actually understanding or metacognating enough about outside of their own kind of experience, and attempting to understand more gainfully what it is that
because in my opinion on that, it's like, I mean, as a small tangent off of what you said, managing the symptoms is kind of a flawed approach in my opinion, because the reason why the symptoms even appear is for a reason that many therapists don't even understand, because personality disorders itself is just kind of hard to grasp, let alone schizoid, that's just underrepresented. So like for example, when you have anhedonia, and you would try to cure it the way you would cure it in depression, it's not even like the reason why someone develops anhedonia in schizoid is not at all the same reason someone develops it in depression. Very different. So treating the symptom doesn't make the symptom go away, because you're not treating the symptom. You don't even know why it's there. You're treating depression. It's like you're treating A, but the person has B. Like it's not compatible.
I've talked to schizoids that take in antidepressants, and basically they might feel less like depressed, or it might help in some regards, but
but many of them are also depressed in some way.
Yeah, but like the anhedonia or some of the other negative symptoms are still there. So it's like, oh, now I feel empty a lot, but I feel less sad about it now. It's like, okay.
But that's my point, right?
Yeah.
It's if you're trying to treat anhedonia in schizoid, you can't just treat it as you would depression.
Yeah, like the anhedonia that comes from conventional or regular types of severe depression or depression, yeah.
If a schizoid also has depression, then yes, treating the depression will help, because they have depression, so you're treating their thing. But if you're trying to treat schizoid specifically, then no, it doesn't.
Yeah, like I'm on I'm on 2 SSRIs that basically have allowed me to hit less like severe dips in my depression, to where it gets like almost like a delusional level of depression, um I still didn't really like it. Didn't really solve anything internal for me. Like the problems were all still there. I just felt less shitty about them, or less often shitty about them. But the core
Which
issue
could be
was,
a good segue into dealing with,
well,
right?
yeah. I mean, which I already like. I've gotten more help out of the last few years of just talking to and relating to and having discussions on the subject with various people that have a similar issues and predispositions and so on and so forth.
And I didn't realize until today, but apparently there had been some strong correlation schizoid personality disorder and autism from way back when they still used Asperger's as the term.
Mm-hmm. Yeah.
By some wolf guy. I'm sure a few of you might know who that is.
Well, I'm the worst guy with names, but if anybody in the chat knows, you're more than welcome.
Some prominent figure that was in like the 70s, 90s that did schizoid stuff.
I read like a few like summaries of schizoid fucking as a term and how it was used and so on and so forth.
Yeah, but
anyway, I remember this name, but I just
the thing I learned today was that and this kind of was a little bit on to what we were talking about earlier, is the reason why I think, in one of my opinions, that the neurodivergency isn't being considered is because therapists are far too quick to diagnose one or the other, because they themselves don't understand the differences between what it means to be autistic and what it means to be schizoid. Because even when I speak with you, Angst, externally speaking, there are very often times when I tell you straight up, you act autistic, even though I know you're not. Mm-hmm. Right? So there's a lot of external things that, because autism is
they're conflated basically together.
Autism is very represented, even if there's problems still, whatever. People understand autism. They see it a lot more prevalently. Mm-hmm. And if those are the symptoms we know to look for, then yes, you look autistic. Mm-hmm. If there's not any schizoid representation to counteract.
That explains why a lot of schizoids, especially if we're talking about ones that are overt or whatever, are oftentimes like questioning or discussing whether they might be autistic. Like that's like such a common thing. I hope he's still okay out there, by the way. There's a guy called Greg at the Dump, and he's I don't know if he still does. I haven't checked in a long time. I'm so damn busy. But he would upload occasional videos, right, regarding his condition, and he was definitely in the more extreme side of things when it came to whatever was giving him these issues. Like his home was, like a lot of stuff was kind of in disarray, but he was sort of indifferent and ambivalent about it. But at the same time, you can tell that there was like a certain underlining sort of suffering occurring. He had health issues that he wasn't really taking care of. There's also kind of that sort of ambivalence to that too. And then when he would sometimes talk about seeing, counselor or whatever, he would talk about how like, they're talking about maybe he's autistic. They're talking about maybe he's this, maybe he's that. Like they're trying to pinpoint why doesn't he feel motivated or have any ambition to, improve aspects of his life and everything else. And he was just like, I would watch his videos and I'm like, dude, this is just the sweetest dude. He's such a cool dude. And yeah, he would often sort of bring this up. I don't know what the current situation is. I think they went with the autism or something. I'm not entirely sure. But yeah, if you haven't seen him, he's a little hard to find. But the channel name was Greg of the Dump. I think he's like a British dude. big old scraggly beard. He would talk about basically not leaving his home for like weeks at a time, not eating, just basically some of the like worser case scenario type situations. Complete isolation, complete lack of taking care of his health and taking care of like a lot of stuff in his life. But he had really interesting special interests and hobbies that he would talk about and ideas that he would like philosophize about, and he was actually pretty funny sometimes. But yeah, I don't know. I have to go back and take a look. It's been a little while. I tried to reach out to him a bunch of times. He only talked back on a few comments, but I would love to talk to that guy for the channel. But yeah, that's kind of that's the reason I'm bringing that up, is because in his situation, in many situations I've seen, it's like this back and forth of like, oh, what the fuck's wrong with me? Is it just a personality disorder? Is it because of ADHD? Is it because I'm autistic? Do I actually have like some kind of only negative symptom version of schizophrenia? What's happening? Am I going to develop schizophrenia because I'm already behaving internally? My world is already very much like a schizotypal person's like, but I'm masking and I'm not showing it. Oh, you've gone through tons of that shit.
I've been through a lot of that.
You're still going through parts of that.
That's relatable as hell.
Yeah. And so like,
I feel a lot better today though, because
good.
I've been listening to more based like on actual like therapy, and like there was this therapist I was listening to that has actual experience, well documented experience in patients, and I was about to read this handbook that gets passed around in the Zoid Void constantly. That helped. I really need to delve more in.
I think I know what handbook this is, but can you
Zachary Wheeler.
Yes. Oh wait, I think I know which one that is. Send me the link again. I gotta go. Yeah.
I got it on my phone.
Yeah, just put it on. Give me a link to that. I have to go through it again. There's a couple of things I have to go through. There's one I haven't read in like a year and a half that I have to go through. That was one of the most interesting ones I came across, which was you probably read it, but it's that one. It's that one study, and I tried to get a hold of the Italian doctor. Yeah, Gregor the Dump. Yeah, look him up. Cool guy.
What really helped and centered me today was, believe it or not, a therapist talking about schizoid that had a great deal of experience and specialty in regarding personality disorders.
Well, you watched something, you said?
Yeah, I was listening to.
Is it that one guy that you
podcast guy? Yeah.
Yeah. Okay. You gotta.
I was listening.
Send me his best of, because I gotta check some of that out more. I
well,
listened to a little bit of it. Yeah.
Yeah. The paid versions in his Patreon. Well, I
might do
so much better job.
That's why I might have to join his Patreon just to get a hold of it.
Two of the deep dives are friggin' 2 hours long.
Yeah, that sounds interesting. I don't, because what I like about listening to other people talk about this subject matter and professionals that do have some.
Oh, you love him.
Yeah, well, I'd have to find out for myself, but
well, in my,
I don't know if I'll love him, but I might like some of his work.
Yeah, you'll drop your wife and family for him.
Oh yeah, great. Let's run away. Anyway, run away together into the sunset. No, but it's just like oftentimes I have like all these ideas, and like I'm just trying to figure stuff out, and it's nice when somebody with a better handle on the lit says, Khalil said, is that Dr. Honda? Is that who you're talking about?
What his name is.
Oh, he doesn't know what his name is. That's not what Shadow pays attention to, the guy's name. That's his ideas.
I know it's, for anybody that might be aware of it, the podcast Seattle or something, Seattle podcast. That'll ring a bell for those.
Yeah, okay, well, post a link in the chat so some of these people can go down their own rabbit holes with it, if you don't mind. His YouTube channel, and then they can decide what to do with that. But yeah, I heard a little bit of it. I gotta go into it more. He sounds pretty reasonable. In many
Just
regards.
rings a bell. I think that's actually
Might be.
what he is.
But yeah, anything is better than Dr. Todd Grande when it comes to the subject.
Oh my god! Don't even get me
Yeah,
started.
I know. So,
It's so bad.
well, there's a few people I've found out there on the internet that, like, that there's a lot of therapists that have YouTube channels that, like, they try to, like, cover everything because they're trying to, get clicks. And they'll just be like, oh, today we're talking about schizoid personality disorder. And it's like, yeah, okay.
It was really, really nice because even this therapist that I was listening to had like 20-30 minute segment elaborating why there's so much stigma regarding like what was it?
Stray or
Physical like violent tendencies that crop up with personalities, not just schizoid personality disorders in general. And it was just a very long, in-depth thing of there is a correlation, just like there is a correlation with any personality disorder. And he explained, for example, schizoid has technically a higher percent chance, even if it's only slightly, because if you were to get in a situation which unleashed emotional response, you would have an underdeveloped ability to cope with that. So you technically would be a little bit more likely, at the very least, of not being able to handle it as someone else who has plenty of experience with handling emotions,
right? I mean,
right?
yeah.
So
it wouldn't be.
The example was like if someone, like if the neighbor was mistreating your dog, you knew home, then the chance of you being more violent to protect your dog is higher than someone who isn't schizoid. But whether that's being schizoid doesn't make you violent. It just, for some, it could be that final straw.
Yeah. They have situations where they fucking.
I really enjoyed the way he elaborated that at length.
Yeah. I mean, because when you're talking about, obviously when you're talking about somebody that's schizoid, you're talking about a person that disassociates or just compartmentalizes any negative emotion, or just kind of doesn't feel it much, and then navigates it intellectually.
But then, if perchance you do have that moment where an emotion hits you,
then it's like a
2 months ago, Angst. You know what happened. Fucking
well,
Christ,
I've experienced that. It just hits you like a fucking dump truck.
Oh my god, it's horrible.
Yeah, it's pretty shit.
It's like a dam that breaks.
Yeah, it's no buenos, man. And that's why it's better to.
It's real, people. It's real.
Yeah,
it's rough.
I've seen it happen more than once. Not just in myself, but in a lot of people that deal with this stuff. They'll have like a complete fucking meltdown for like a while, and then they'll just go right back. If they recover okay from it, they'll just go right back to it. It's like they gather up their "it is what it is" again, and then just kind of
and it's like partly why I was so confused and searching all these other more emotional based disorders.
Yeah,
because
like,
it was just like how could this have any correlation with schizoid if this is all about emotions and like feelings?
That's not allowed.
Right?
That's not allowed to be.
But to be honest, I think it has everything to do with schizoid, and that's kind of why this is reoriented.
I mean, it might be that section, and even Akhtar's profile about the odd crimes. So like that they have a penchant for like schizoids have a penchant for odd crimes. Like when I read odd crimes, I imagine like a situation, kind of like what you said with the dog, but I imagine a kind of a different situation. I imagine a situation where like you have a schizoid person that's kind of like keeps to themselves, doesn't cause problems, stays away from others, blah blah blah, the usual expectation and understanding of what generally occurs, which is often true. Laid back or just emotionally sort of even keeled, seemingly, or if not, just almost like not very emotional at all. And then I don't know, they walk outside, and it doesn't even have to be their dog. They're just like an animal lover, and they just see like some guy across the street kick his dog that's not listening to them, right? And that might just they might go across the street and just fucking kick that guy's ass and go to jail for assault because they beat the shit out of some guy that kicked his dog, and they have like maybe little to no criminal record or history of doing anything like that. And it's just
even that could be considered like by many a like indicating of some sort of autism spectrum, because that relation to animals and that very intense need for this like justice, right, and retribution for something as meek as an animal. That's a lot of people would not do a differential on that and just immediately go confirmation bias. Oh, that's autism. I've seen it before.
Oh, based on their despondency, based on
how
now they're calm,
and you have no idea.
You just kind of
never asked why the person cared about the dog. You just like, oh, I've seen this before. It's autism.
Yeah, or like the person. What's interesting too is the enraged, person, or the suddenly destroyed and depressed schizoid by this one situation. Might not even fully comprehend why the fuck it is that they fucking snapped about that to begin with. I was talking. Remember, I talked to you about like that's like one of the few things that can kind of put me into that kind of like weird state of mind of just being like, this is wrong. No, fuck this is like stuff that has to do with kids and me.
And I'm literally this.
Yeah, so when it comes to kids shit, like I'm just like, if I see the mistreatment of a child, like I'm fucking seeing red, man.
For me, it's
and I'm just like even keeled 90% of the time.
Yeah, it's not necessarily kids that activate my kill switch. It's or sleeper agent, I should say. Yeah. The sleeper agent, right?
The sleeper emotions. Yeah.
For me, it's kind of just seeing someone. It's like there's a degree of struggle that's everybody has and everybody goes through. Like if someone goes through hard times, they're just like, oh, well, that sucks. But if someone's like falling into like a slope of despair and like the emotion of despair, I really don't. Hard times, it is what it is. Really hard times, man, that sucks. Despair and like giving in really sets me. Like a lot of like sometimes. I just imagine.
I know, I'm just kidding, but I just imagine
sadness.
You finding a person that's in despair, and you're like, that pisses me off, and you start kicking their ass.
No, but it's like if it pisses me off, it pisses me off against the abstract.
Yeah, the concept. Yeah, no, I know that feeling for sure.
But if it makes me like really sad, like there's like the very few times I've cried because of watching a media, it's always someone like losing whatever matters most to them and like seeing their despair as they try to like hold on to it. Oh, yeah, fuck.
Just a husk.
Fuck.
Well, it's a feeling, man.
Most days I can't even feel anything, but sometimes there's certain like parts and medias.
Well, and honestly, I think a lot of it has to do with those things in your life and in your internal world that you actually have a strong.
Of course, it's all relatability.
Yeah. And
like,
so
your thing with kids and my thing with despair, it's completely just something I relate to, which is why autism spectrum was considered psychopathy before people understood, oh, it's just because they don't relate to us.
Yeah, they thought, oh, it's psychopathy because this person's having a fucking screaming meltdown over something we don't understand.
So yeah, it's obvious that something that's relatable gets an emotional response.
Yeah, and it's something not just relatable, but it's also something that's like, it's runs in conjunction with my internal world and what ideas and concepts I have inadvertently sometimes placed importance, subjective importance, value, and emotional connection that I might have oftentimes trouble reaching and finding. Not so much now, but definitely in the past. But anyway, totally off into the weeds there as usual. But yeah, I think see, like the conversation we're having right now, how we're having it, that sort of more back and forth, sort of investigatory approach, and then working in conjunction with the discoveries of that client, that schizoid patient, I think are the only fucking ways that you're gonna make any kind of progress.
And what I think is especially important, maybe it's just because I'm more prone since I consider myself autistic and that I need more context and honesty. But with that being said, if someone does get triggered because you're engaging with therapy and a trauma response comes up, I think the best way to approach that is will make like if they don't shut down, right? If they don't shut down, and this happens with me every so often, it happened with me today even. If the person is willing to fight through the response because they can kind of see the pattern that they've repeated in the past before, and they're like, okay, I want to try again. I feel like I have room to try this over and this time make it different.
Mm-hmm.
I think what's really important that I try to do myself is express, oh, this is what I said. I'm not apologizing for what I said because I still think it's important. I don't think it's something I really can apologize for. But I will tell you straight up, this is why I said these things. Not because of what would trigger your trauma response, because I was trying to be this and like if I came up with a like if I was expressing something and the client or the schizoid patient took it as they are uh, reducing my struggles and hardships just like my family would have, and they're making light of my struggles, I, in return, would respond with, I understand that's what you thought of it, and it's not trying to say that you're wrong for thinking that, but rather it was my intent to try to come across as not that, but this other thing instead.
Yeah, that got really convoluted, but I think I'm following you.
Yeah,
There was a lot. There was a lot of qualifiers there.
yeah. Well, it is
Yeah,
really
yeah,
nuanced,
yeah. No,
but
it is.
it
But
in a better way to try and explain it, it's I understand this is the reason why you perceived it this way, but I wanted to make it this other way. I wanted you to perceive me this other way because I'm not trying to offend you or I'm trying to hurt you.
yeah,
Like literally just saying, I am not trying to hurt you because this is what I wanted to, and I was hoping you could see it that way instead.
yeah, yeah. Of course. I mean, that reminds me of another thing that I think would be really important, just to get a little bit back on this before 8:30 hits here. The One of the other major things that I believe a therapist or a psychologist, whatever, would have to be very very wary of, very aware of, is making assumptions regarding the idiosyncratic nature of the schizoid person's concerns in regards to why they have those concerns, right? So let's just say my concern, right, is about this like idea or this concept and what it means and what it represents to me, and in conjunction with my perspective and all, like this kind of very, very much like oftentimes very complicated internal thoughts about like something or another, right? Multi-layered kind of shit usually. And then the therapist hearing all that, and all they are getting from it is, oh, this person is just circumventing or not coming to terms with the real problem. And that's something that's incredibly discouraging for what I would believe would be most schizoid patients, which would kind of they're coming at it like, this is how I feel about this idea and this concept, and this is how it affects me. And I don't sometimes fully comprehend why it is that it affects me as it does. but this is what's happening, and this is how I've come to terms with it, or how I see it. And then, yeah, having that psychologist just go, oh, well, this is because you're just, not ignoring, but you're like couching the real problem with all this kind of convoluted thinking and intellectualizing and so on and so forth. Man, that shit's devastating.
To me, that sounds frustrating because it's making light of
Yeah,
your neurodivergency.
it's invalidating your fucking experience completely.
Yeah, it's invalidating your experience, but why is it invalidating your experience?
Well,
how is it invalidating?
Well,
Right?
because it's not being recognized as its own thing.
Yeah, to me it sounds like they're imposing their neurotypicalness.
Yeah, well, they're not
your
that's why I want to
neurodivergent.
be careful
That's
with imposing.
how it sounds like.
That's how it feels, but that's not what they're doing, right? Because there's no actual action that they're kind of, you know what I mean? Like, there's no actual action they're taking.
I didn't get that impression.
Yeah, but they're not going, oh man, this guy thinks weird. Let me rearrange it to the correct thing. No, it's just because
you said it was it's not that reason, it's because of this other reason.
What?
It was very direct language that was invalidating.
But the thing is, but let me explain what I kind of mean a little bit. Let's just say I'm talking about this abstract concept, feeling, thing that it represents, and why it infuriates me and causes me depression and causes me all this like struggle internally, whatever. If that kind of stuff does happen, what they're concerned about, what they're worried is occurring, is definitely something people do, and it is common, where they're kind of changing the focus, or what's it called, redirecting the issue, right? Because they're attempting to like get around the core problem, right? That's something that happens. Deflecting, yes, that's something that absolutely happens, and it's very, very common. But the problem is that when the schizoid is expressing these kind of seemingly like runaround ways of not dealing with the core issue or something, the core issue might just be that. The core issue might be the thing they're telling you. The other issue might be that they don't know why it's such a core issue, and they don't know why it has had that impact on them, and they don't know why, or what it has to do with their inability to connect to other things or people, situations that aren't that type of thing. That's what they should be asking and working on. But yes, luckily for me, when my psychologist much early on attempted to sort of have that kind of conversation with me, I explained, I could see how a lot of schizoids in that situation would just get discouraged and give up and then stop seeing their doctor altogether. But I didn't do that. And I was like, no, that's not what's happening. Let me explain to you what's happening to me. This is my experience. Let's try to work within that experience first, please.
If you use the language of, no, this is what this really is, that, good intentioned or not, that's still imposing.
No, I'm talking about the schizoid saying that to the psych.
No, I understand that, but from your earlier example, if the psych redirects it and frames it as something else,
and then you correct
the language you use, specific. If they used the language that you use, that would be imposing.
No, because they wouldn't know they're doing it, because they're running under an assumption that is oftentimes true within their field.
But that's still an assumption that they're imposing it.
That's not imposing would require intent of some kind to like, when I think of impose, maybe I'm wrong. When I think of imposing, it's like an active, in this condition or in this case, it would be something in which they're actively doing something to invalidate you, to basically validate their own position. But
And this is like, and I'll give you an example to make it a little bit clearer. Instead of the language you used, which sounded to me imposing and very, this is the answer because I've seen it before, and maybe even if I have the qualifications and experience to know better, I can still be wrong, but I'm not giving you the opportunity to have a chance to say I'm
okay.
right. So instead of saying that's not what this is, you're deflecting, I've seen this before,
Yeah.
you could say, this sounds like you may be deflecting from my perspective.
Oh yeah, yeah. Do you believe
That
no,
is
I
a
know.
much
But
that language is
get
important.
that. Okay,
It's important.
I get what you're saying. I agree with the language.
Okay.
The point of contention was that is what the former example I gave, is it imposing? That's the only conversation I'm having with you right there. Like, I agree with there has to be a better approach, but oftentimes there isn't. The approach you described is absolutely far better.
Yeah, but that's why I would say your original approach, or the original language that you gave an example.
Right?
But I mean, I feel like imposing is the right word.
I don't think it's the right word. Maybe I don't know who's right. Does it matter? Like, I don't.
Yeah, I don't know.
You're getting stuck on a word.
You brought it up. I am adamant about the word imposing.
Okay, all right. It's imposing. Tomato. I just
think
maybe
it's
I don't know
okay. I
who's
think
right
people do
about what the word imposition means. I don't want to look it up right now. Somebody chat. To me, when I think of imposition or imposing, I see it as a conscious effort of some kind to do something, to invalidate or overrule something someone else is attempting to do, or push your will upon their will in some intentional way.
In my
like
experience,
imposing a rule. Or
the most toxic imposement I've received were of good intent.
See, but that I get. See, yeah. No, good intended impositions are not good either. If we use what I'm thinking imposition is, or imposing is.
Yeah.
But in the case of something like in the case of what I was describing, that's usually not what's occurring. It's not like a well-intentioned imposition. What's occurring is their understanding of their own profession and what occurs, and what often is, they're educated on and how it works, that gets them to the place where they make statements like that. And most of the time they probably done this in the past and with other clients, and it was successful in allowing them to access things that they were in fact convoluting in some oftentimes unintentional way, some core issue or problem. But
so it just depends on the degree to which they believe they're certain, I guess.
I mean, certainty is definitely a very important thing, right? Like if a person goes up to you and they look like a human and they're dressed like a human, they sound like a human, and they say, I'm secretly an alien trapped inside a human's body, right? Would it be like an imposition for the person to go, I think that's unlikely to be the case. I think maybe something else is going on.
But that's not the language you used in your example.
Yeah, in my example, I said that you tell them.
I think it was, this is what's happening.
Well, no, the alien saying, oh, no, the alien doesn't, sorry, the person says, I am an alien inside a human's body. There you go. Okay, fine.
The imposition would be if the human were to say, no, you're a human. Like, as a blatant, defiant statement.
So should we approach them with the idea of, it is my opinion that you are not an alien? Like, so that might be the more appropriate approach, I guess. That's fine.
Well, I mean, if we're in therapy and you tell someone, it is my opinion you're not an alien.
Yeah, but usually that's not what I said. Maybe that's not how I said this. The psych would say it. Did I say I thought I said I believe, or I think, or what's occurring here might be. I thought I said that. I thought I had some caveat of some kind.
What I meant to say was, okay. I was trying to separate the alien statement from deflected statement. I was like, I don't think
we're losing ourselves. Oh God.
I think it's okay to impose that the person you are working with is in fact human. that is okay.
Yeah, but then it's not. Is it an imposition at that point? Like, I feel like imposing would be you kind of suspect, or there is a distinct possibility that there's an understanding that there are aliens in human bodies, and you're
How about
you're
this
just
one?
invalidating their experience of something that is,
How would the
understood to
schizoid
occur.
perceive it?
Perceive what?
If they were to explain to a or therapist that of their idiosyncratic idea that seems like a core important aspect to them, even if they don't understand why, and maybe even ask, why is this such a core aspect to me?
Yeah.
But this is the core aspect.
Yeah.
And the therapist, what was I just about to say?
I don't know, man.
I had it, and then I lost.
It's okay.
What were we just talking about?
I don't think we just went completely off. Who cares?
Okay, it was about the schizoid's perception. It was
about
if the
that
therapist
situation.
if the therapist asserts
Mhm.
that posits, how about that? If
Okay.
a therapist posits, but in a more word, if the therapist posits their opinion in a blunt manner,
Okay.
how does the schizoid, or how would a schizoid that is on the road to understanding or recovery or treatment perceive that? Because I think many schizoids that are at least still struggling would perceive that as imposement, at least subconsciously.
Oh yeah, no, absolutely, they will.
So that's my point, right?
Yeah, but
so does it matter if it's imposement or not?
No, it's just a word. I'm just saying I don't agree with the way the word's being used. I'm not saying that the feeling won't feel like imposition. It'll absolutely feel like it's an imposition, and it's being like forced upon them. Of course, it's going to feel like that. Now, is that the reality of the situation? I think it's a lot more nuanced than that. Than how they feel it is occurring. There's a little bit more happening there.
So then
That's
you
all
just
I'm
wouldn't
saying.
say something so defiantly, or not defiant, something so
No, you wouldn't be mad. You would just say
you wouldn't say something so blatantly because you know that the schizoid might perceive that as imposing.
no. That's
So
why.
even
That's
perceived
why
imposing.
I'm saying don't.
Okay, I don't know why you're arguing with me on this. Maybe we can just
I
agree to
wasn't
disagree.
arguing. I'm just saying. My point is, if a psychologist does that to you, I was getting to it, but then we got stuck on fucking this shit. When a psychologist does that to you, it's definitely better if you don't see it as an attack on you or an imposition or whatever you want to call it, or just go straight into this headspace of disappointment and discouragement. Push back on it, explain to the best of your ability. No, this is truly where my thoughts and my understanding of what I care about is at. I'm not just intellectualizing things.
Yeah, the same way many schizoids
let me finish. And the same way, no, now I'm saying what you were saying. Fuck you. Anyway, no, shit. Okay. So you push back by telling them what the situation actually is, as it is, and then you say to them, if you want to present a case as to why I'm wrong, and that's not where things are, you're more than welcome to, as long as I'm able to make arguments as to why I don't agree. And we can talk about that if you want. But if your psych is unwilling to even do that, get a different psych. If your psych is willing, like mine was, to have a conversation, even if it lasts 2 or 3 sessions, on the matter, might be worth keeping. Be helpful. So, that's what I was going to get to. Christ. Are you still stuck on the word, or are we going to talk about the fucking word?
No. I wanted to explain that I think both of what our perceptions of this same situation are. It depends on where you're at when it comes to like how severe your schizoid personality
I know.
disorder is.
That's why I'm giving the advice.
I know. I understand that, Angst. But I wanted to separate
Man. Okay.
your perception of the situation would be if the schizoid has more mild
Yeah.
disorder that is able to stand up to a perceived imposition. Right? Because many schizoids wouldn't even
No,
be
yeah.
comfortable enough to do that. That would trigger
Well,
trauma.
many won't be comfortable enough to even go
Right?
through the process
So
or even show up.
that's so when I say perceived imposition, why you disagree is because I'm looking at it from a schizoid that is far more severely
No, but
impaired
you
in
were
that
using the.
department.
Oh my god, we're back on this. You were using the word imposition as a generality of the situation. You weren't specifying it had to do from the perspective of the schizoid until
Well, now I
after.
am.
Well, now you are, but that's not what you did
Okay,
initially. God
that's
damn.
okay.
Okay, that is okay, but we're still back on this. You drive me crazy. I keep losing my thoughts. The only reason it drives me crazy is because I lose my thoughts because I have fucking my ADHD brain. I'm taking meds, but it's not enough.
I'm autistic. I focus on one thing.
Yeah, I know, and I tried to
I
focus
explore
on
every
20.
caveat of the one thing,
Yeah,
and
yeah,
then I
I
move
know.
on.
Yeah, thank
That's
you.
what I do.
I know. I know. It's fucking drives me nuts. But yes.
For those that are mild, fight your psychiatrist.
Yeah, and for those that
Psych-
aren't, do it
therapist.
anyway. No.
For those that aren't,
Think back at what I said and
sucks.
find the fucking cojones to do it. No. I don't know. But it's just maybe they'll think about it and internalize that, and then maybe they will find that they will self-advocate in that way in some unusual sudden emotional burst of energy. I don't know.
Stop imposing yourself on.
Yeah, I'm imposing myself, right? They just freak out and punch their fucking psych in the face. Ah! And the psych's like, I don't really think. I think you're just intellectualizing the system. Like, just go wild on them.
Actually,
Get
you're just
taken away.
deflecting. Fuck you. Deflect this fist, bitch.
Yeah, I mean, because I'm just doing a callback to the whole like having the sudden emotional burst, freak out, meltdown. You're just like all of them. So, but anyway, guys, let me show you with my body now. Oh man, I'm gonna pound my internal world into your face.
Oh,
Anyway, okay. So, thanks a lot, guys. We already got past a little bit. I like to end this at
speaking of
8:30. I went a
pounding,
little.
how about you pound that like button, subscribe.
Fucking hate you. So anyway, thanks a lot, guys, for being here. I appreciate it. If some of the stuff makes sense that I'm saying, DM me. Give me a message. At me in the server. Send me an email about why you think I'm a fucking stupid idiot and I'm wrong, or why you think what I'm
His
saying
address,
makes
walk
sense,
up to his
or
door,
why you
ring the
like some of what
doorbell.
I say but disagree with some of it, or just want to call me a faggot, and that's okay. I can say
Ooh, that's a no.
no, I can say that because I have
sure?
I have the F word pass.
Okay, but like still, I don't.
I thought I had
think
the
that's a
F
no-no
word
word.
pass.
No, I don't. I don't think
No.
anyone has the F word pass.
I was talking about cigarettes in Britain.
Yeah. Cigarettes and Minecraft.
People calling me cigarettes in Britain. In any case, yeah, thanks a lot. I appreciate it. And support me on Patreon, PayPal, and all that garbage can stuff that I have to do to keep this ship running. And like I said, comments, please, below. Comment if it's Twitch, fucking whatever works. Just send me a goddamn DM or at me on the server, or whatever. Email, DM me on Twitter. I don't care. I want to hear what you guys think, whether you fucking hate me or you think what I'm saying is interesting. Just whatever you do, don't come at me saying all these nice and positive things about me. I will
Give
block.
him a
I
nice
will block
cylinder-shaped
you.
present
I
to
will
his
fucking
mailbox.
block you and report you for spam. Okay. All right, guys. Peace out. And as usual, when day is dark, always remember